To introduce the plenary speaker today. And before I do that, I'd like to mention that for all the plenary sessions of this conference, there are no questions and answers after the respective lectures. We regard these lectures as statements from the podium, and if you have any questions or so, please contact the plenary speaker at some other point during this conference. It's my sincere pleasure to introduce Professor Shinichi Kikuchi from Japan, who will give a plenary lecture on the topic of international collaboration beyond the culture gap. Dr. Kikuchi graduated from Fukushima Medical University in 1971, and he studied as a clinical research fellow in Canada with Professor Ian McNabb in Toronto in the late 1970s. Dr. Kikuchi was professor and chairman of the Department of Orthopedic Surgery at Fukushima Medical University from 1990 to 2008, and thereafter he serves as president of that university. His main field is spine surgery and is very well known and recognized internationally for his research, both basic and clinical, in the spine field. He has published more than 100 papers in international peer-reviewed journals, many book chapters, and he is currently deputy editor of the journal Spine. He received the Volvo Award and the Isels Award at different time points for his spine research. And he was president of the International Society for the Study of the Lumbar Spine in 2005 to 2006. He is currently president of the Japanese Spine Surgery and Related Research Society, and he has clarified many basic mechanisms underlying back pain conditions and other related spinal disorders. He has also been instrumental in promoting and forwarding international collaboration between various research groups, including his own research group and research groups in the US, particularly at the University of California, San Diego, and at the University of Gothenburg. And Professor Kikuchi holds an honorary doctorate at the University of Gothenburg as a recognition of his important contributions in this field. So it's my pleasure to ask Professor Kikuchi to come to the podium and give your plenary lecture. Welcome.
Thank you. Thank you very much. But at first, I have to apologize for my poor English. So please give your attention to the slide, not to my English, okay? So this speech is based on my presidential address made at the 33rd annual meeting of International Society for the Study of the Lumbar Spine, ISRUS, in Norway in 2006. The data in this speech are updated. I'm very honored and pleased to make this speech encouraging international collaboration at this second meeting. I will talk about the importance of collaboration crossing interdisciplinary and national borders based on my own experience. CICOT was established in 1929. The 14th World Congress of CICOT was held in Kyoto, Japan in 1978. 3,155 persons from 62 countries participated and 979 papers were presented. Dr. Nakemson was one of the charter members of ISRUS and had been a leading person of the society for a long time. He delivered a lecture with the title Cross the Borders as a Steindler Award lecture. In the lecture, he said, "We must cross both interdisciplinary and national borders. Fortunately, we need not be multilinguistic because English has become the common scientific language. But for us Japanese, the fact that English is common scientific language is not fortunate." According to Samuel Huntington The most important groupings in the world now are the major civilizations. Japanese civilization is very different from others. Japan has been modernized, but not completely westernized. Japanese civilization only in Japan, one country, though each of the other civilizations includes 2 or more countries. Japan has no close cultural relation with other countries. This is why it is difficult for Japanese to communicate with other people in other civilizations. What image do you have of Japan? High technology, traditional culture, beautiful nature? Recently, young people may imagine animation like Pokemon or comics. I will tell you some typical differences from Western civilization easily found in our daily life. In Western countries, they sit on chairs with shoes, but we sit on tatami or floors without shoes. Greeting is also very different. Japanese usually bow. We never hug or kiss. So Western people may feel strange when they first meet Japanese. In Western countries, the ability to use good speech is very important, and children learn how to debate from the early age. In Japan, silence is gold, and eloquence is silver. To assert oneself strongly is regarded as ungraceful. Our silence, smile, or ambiguous attitude or response may make Western people feel uneasy. Books are quite different, opposite. On the left is Samuel Huntington's famous book. It is written horizontally from left to right, and it is right-handed. On the right is a book translated into Japanese. It is written vertically from right to left, and it is left-handed. Major religions in the world are mostly based on monotheism. Christianity, Islamism, and Judaism all believe in monotheism. Japanese lives are based on polytheism. There are many Shinto shrines and Buddhist temples, and we have nature worship, animism. We believe that everything in nature has a life, as well as human beings. Cultural differences can be seen in the field of low back pain. There is a study that compares American and Japanese low back pain patients. It shows that Japanese patients were significantly less impaired in psychological, social, vocational, and recreational functioning than American patients. Low back pain means different things in these 2 countries. In the United States, it is a cause of disability. Disability emphasizes to get compensation. In Japan, low back pain means just a little sick condition. There is another similar study. These are data Dr. Nakemson presented in his lecture. The 1-month prevalence rate of low back pain in Japan is higher than that in the United States or Sweden. But the yearly rate of disability is much lower in Japan, and insurance coverage is also lower. This may be because of the social factor in Japan that achievement of the work group takes precedence over that of the single worker who does not want to discredit the group. This difference may be explained by collectivism and individualism. These data suggest that low back pain occurs only at the intersection of bodies, minds, and cultures. As I said before, the present world consists of different civilization groups. Cultural commonalities and differences shape the interests, antagonism, and association of countries. The conflict most likely escalate into broader wars are those between groups and countries from different civilizations. The most symbolic events of the clash of civilizations are September 11th in New York and Israel-Palestinian conflict. The greatest threat in the world now is not a conflict of ideology, but a clash of civilization, and it will continue to be a serious problem. Now, I will talk about the relation between medicine and the history of civilization. Julius Caesar gave Roman citizenship to all the teachers of liberal arts and medical doctors in Rome, regardless of ethnic origin, color, race, and religion. Caesar was the first person to recognize the importance and universality of medicine. It has been recognized since the age of Roman Empire that medicine and medical doctors have importance and universality beyond national borders or race. We should reaffirm the universality of medicine. I will examine ISRU's activity in view of crossing borders. The first meeting was held in 1974. The charter members included orthopedic surgeons, basic scientists, and engineers. The 37th meeting was in 2010. The members ranged from anesthesiologists to statisticians from 17 fields in all. The professions of our members have been expanded these 35 years. Next, I will examine the nationalities of our members. At the first meeting in Longueuil, Canada, the president was Dr. Wilsey from the United States. The charter members were 71 from 11 countries. The 37th meeting was held in Auckland, New Zealand. Dr. Balag from Switzerland was the president. The members were 387 from 26 countries. The logo mark of ISRUS was designed by Dr. Pheasant of California a year or so after the first meeting, and first seen on the program of the third meeting in Bermuda. This logo symbolized international collaboration in the world of spine. I will review international collaboration in the presentation at our annual meetings. The number of international collaboration research projects started to increase in the 1970s and then greatly increased in the 1990s and 2000s. This tendency can be seen in the Ball Award and the ISRUS Prize more strongly. Furthermore, it is also seen among Nobel Prize winners in the field of physiology and medicine. Great scientists influence one another beyond national borders and create greater achievement. Now I will talk about my case. I am a typical Japanese. My study room at home is a traditional Japanese room, and I sit on tatami in Japanese kimono. On the other hand, my working place is completely Western style. My first experience to cross a national border was brought by one great mentor. I was deeply impressed by the papers of Dr. Ian McNabb. For the clinical fact, everybody knew and accepted as natural without any doubt. He wondered why. He clarified this fact with basic research and clinical examination, and he applied this knowledge to clinical work. Attracted by him, I visited him at Wellesley Hospital in Toronto in 1977. I had no connection with him, nor any offer of fellowship, and I spoke very little English. He allowed me to stay as a visiting fellow and kindly taught me the way of scientific research and clinical work. Dr. McNabb published the paper in the JBJS on the cause of failed back clarified with nerve root infiltration. When I asked him for a chance to do basic research, he challenged me to clarify why nerve root infiltration shows a tubular fall. The right figure is his note written at that discussion. He had a hypothesis that there should be some structure to keep contrast material located around the nerve root in a tubular fashion. Anatomical study demonstrated the presence of fibrous covering called the epiladicular sheath. Dr. McNabb's hypothesis was proved by this study. In 1993, about 10 years later, Dr. Wilsey reported at the ISUS meeting that this structure played an important role for formation of hematoma or extension of tumor. The clinical significance of the epiladicular sheath and epidural membrane was emphasized again much later from another point of view. The facts indicate that scientific research developed crossing time and interdisciplinary and national borders. I first participated in ISUS in 1978. It was a fifth meeting in San Francisco. At the meeting, I met many famous spine researchers. I thought I could improve myself through participation in this society. It was a ninth meeting in Toronto that I got a chance to start international collaboration. Professor Ledvik and I presented the papers in the symposium called Pain and Nerve Root. This meeting linked us through our common interest on nerve root. I told my young colleagues the importance for us Japanese to study in different civilizations and started to send a fellow to the orthopedic department of Gothenburg University in 1992. Professor Ledvik has kindly supervised these students. But this photograph beyond is very slim compared with today. This long-term collaboration was recognized, and I received a degree of honorary doctor at Gothenburg University in 2003, with recommendation by Professor Nakemson, Professor Ledvik, Professor Oldmacher, and Professor Hanson. The ceremony was held in this hall, and I got the degree on this stage. I have sent 14 fellows to Gothenburg University. Their experience in Gothenburg University is a great treasure in their lives and for our department. Dr. Nakemson often visited my department and gave us good suggestions for our research. He advised me not only about research, but also about my life. When I became a professor and chairman, he gave such advice as in the slide. 1 year before he passed away, he came to Fukushima to celebrate the 15th anniversary of my professorship. This is a picture at the party. When he had in his hand, unfortunately, is not the literature of EBM, but the label of the good wine. I met Professor Myers from the University of California, San Diego, through exchange with Professor Ledvik. I have sent 7 fellows to his department since 1997. As a result of a collaboration study, we received the Volvo Award in 2000 and ASUS Prize in 2003. Our research is going 24 hours a day at some place in the world. The collaboration has made a difference in our research. I have acknowledged the importance of collaboration beyond international, interdisciplinary, and national borders. Collaboration research has made our paper presentation at ISRUS increase a lot. We report some result of international collaboration every year. Based on my experience of international collaboration, I decided to begin an opportunity for international exchange for Japanese young doctors and created the Study Group for Nerve and Spine, SGNS, with Japanese friends in 1996. We have a meeting with 1 or 2 special themes once a year. Based on these themes, we hold a symposium where Japanese top-class young researchers present papers. We present papers and discuss all in English. We invite foreign guest speakers distinguished in that field. With the same concept, I established a new society, International Symposium on Musculoskeletal System and Pain, this year. It is for young doctors in all fields of orthopedics, not only spine field. International collaboration can be made expectedly beyond time and the national border. I published a report of metaphysical dysostosis Janssen type on JBJS 1976. In 1996, 20 years after that, I got mail from the United States asking to send a sample of the patient's blood for a gene analysis of metaphysical dysostosis. This is my precious experience to know that an early study can be re-examined by a new technology many years later in a different country. Pain is a topic that occupies me now. Descartes' theory of pain was the origin of the organic model. The great development in anatomy and physiology in the 19th century created scientific basis for believing that pain was just an electrical impulse traveling along the nerve. I'm sorry. This but there had been different concepts before Descartes. In the right figure, the flagellation by Francesca, pain was presented with a complexly layered historical world of religious meaning, social values, and personal laws. Pain has been considered emotional, cognitive, and social, not simply physiological, before modern science developed. There have been some studies suggesting that low back pain is not caused by mere organic damage. The typical one is shown in this slide. Patients with low back pain received more than 1/3 of all compensation payments. Astonishingly, 75% of these patients showed no findings of organic disease. This means pain should be considered not in a one-dimensional organic model, but in a multidimensional model which encompasses physiological logical, emotional, cognitive, and social aspect of pain. There is a saying in Japan that blind people touch the elephant. Someone touches the ear and says the elephant is like a big fan. Another says it is like a big pot, touching only the belly. Another says like a big horse with a nose. And another says like a big pillar with a leg. This saying can be applied to a study of low back pain. We cannot understand low back pain completely if we study only in our own limited field. Now, we should study brain because low back pain perceived in the brain. It is important to clarify the mechanism of perception of low back pain in the brain in order to improve the treatment of our patient. This means that multidisciplinary approach is essential for new knowledge in low back pain. The pain we see clinically is not the pain examined in the laboratory. The pain experienced by the patient is living pain, according to Dr. Reddish. Living pain cannot be divided into physical pain and mental pain. It can be considered two hands with fingers interlaced. Pain, especially chronic pain, is interlacing of body and mind, and it is associated with social factors, including culture or civilization. We, all the scientists in orthopedic field, are working for the same purpose. We should study in collaboration, crossing interdisciplinary and national borders. The members discussing at the meeting are good rivals and good colleagues who can understand one another's work best of all. Competition is important, but collaboration is more important. Thank you for your kind attention. Yeah.
Thank you very much. Your lecture has really illustrated in a nice way how visions and working in the way that you have done, how much you can achieve by international collaboration. So as a token of appreciation, the organizer of this conference would like to present to you the book called West Coast, Sweden's Ocean Front. Thank you very much for your lecture.
Thank you.
Thank you.